Thanks for staying with us. So joining us on the show today is the Managing Director, CEO, Lagos State Accident and Emergency Center, Dr. Adeolu Arogundade, and the Chief Hospital Administrator, Lagos State Accident Emergency Center, Oluwatomisin Ariyo. They will be talking about the standalone emergency hospital established by the Lagos State government to deliver immediate and life-saving care to victims of road traffic crashes and trauma-related issues. Welcome to the show. Good to have you both. You know, when I found out that your facility is that big facility on the expressway by that 7-Up junction, I always thought it was a deserted place. Like there was nothing like, because I hardly see anything going there. So I was surprised to find that something actually happened. So tell us a bit about this facility, because many Nigerians see it. It's like something that is just there, but we don't see action or activity. Not that we pray for activity, because hopefully we're not dying, but it just seems deserted somewhat.
Okay, so you say something about accidents. You are never in them until you are in them. And that's how it is. We don't want people to come to us. We hope they don't have to come to us. But we know that accidents do happen. And that's why the government set it up there. In our 15-year lifespan, we will be 15 years on the 13th of May that we're officially commissioned. In that time, we have seen about 40,000 victims of injuries.
Not from Lagos alone.
True, from the border cities of Ogun State. We see patients from as far as Ekpe, Badagry, from Indishoremo, the whole of that
Shagamu corridor.
We get patients from all that axis. And mostly because the care is free. And once it's an emergency, it's an injury, we don't turn back the patients. So people have decided that we are the easier spot to come to than going anywhere else.
So I was wondering if there were any such trauma emergency hospitals anywhere else in the world, because that's the only one I have ever seen. And the only reason I know it's working is because I have a doctor friend who worked there before Ijakpa. You know, so where are there others? And, you know, are there really others?
Okay, so the Lagos State Government initiative for that hospital was the first in the country. I'm not sure there are other ones that are exactly like us, but as we speak, we're the only hospital of that type. But we have received visitations from many other states. We heard from Ondo State, Gombe State, Delta State. People have come from all over the country to see what we do so that they can replicate something similar. So I imagine that in a matter of time, we'll be seeing many more like that. And for Lagos State, the plan is still on to have multiple centers like ours across the state. As a matter of fact, the idea is to have it at every entry point route into the state. So as we speak, we have one that has been completed at Ekpe. It's just waiting for commissioning and then staffing. We have another one that is coming up with Access Bank at Ogombo, inside the Naleki Ekpe corridor. They cover that area and is located within the MCC Etiosa facility.
Okay, I said you had talked on expansion already, because I was going to ask that what is the future of expansion, since it's the only facility standing as of date, and you've touched on having other ones spring up. But how are we also going to look at your equipment and the services that the hospital have in place? Because I think a friend of mine visited Lasut very recently, and she really credited the state-of-art facility. Do we have it like that in your facility too?
So that being the only hospital like that, it's a niche service. It's not the kind of service you get everywhere else. The government understands all of that, and a lot of effort is being put into ensuring that we're adequately equipped and trained for what we do. And as part of ensuring that works well, we ourselves are evolving to becoming a training center to train emergency room personnel for the state. And as a matter of fact, even some states have called in to ask that if they can participate in the training programs that we are planning.
So let me come to the Chief Hospital Administrator. First of all, I want to know how long you've been in that position, and what are some of the things that you think the hospital can also do to improve the services that they offer to the public?
Okay, so we all work under the Lagos State Health Service Commission. It means we've been at different hospitals.
Okay.
So this is my current posting, and I've been there for like 6 years or thereabout.
Oh.
So I think what we can, part of the reason why we're here is to let the public know, because a lot of people don't even know we exist.
So,
You know, people have accidents, they don't know there's such a place. You know, and like the general knowledge that people have, that if you have an accident, the first thing they ask is money. Or if you have a gunshot incident, they will tell you go and know. So people need to know that all those things are figments. It doesn't happen like that at LASEC. So once you come, our priority is to treat you. And the minute you get to us, within 2 minutes, you're attended to. Yes.
Do you operate 24 hours as well?
Yes, we do.
let me still stay on you for a minute, because we always assume that in Nigeria we don't have expert facility or expert professionals doing the job. Tell us a bit about your success stories, because I feel like there's an accident. I'm always asking, hey, this lady, they have to cut it off, because you already presume the worst. So that already is depressing. But tell us a bit of your success stories and your capacity to actually save lives.
Okay. So statistics have shown that the survival of accident patients is determined by what is done in the first 15 minutes that the accident happens. So, and that is part of the reason why we exist. So if they're able to get to us on time, we're able to prolong their health. So our success rate, we have about 2%, less than 2% mortality rate since we've started.
Since inception.
Yes. And because, you know, it's instant. Once you get to us, immediately. I personally have had an experience where I had an emergency and I was at the facility. And immediately you get attended to. Everybody comes. So once the alarm goes on, the doctor, the nurse, everybody gets to you immediately. Regardless of who you are. We don't, because for us, every life matters.
Let me come to you, MD. Let me start with you again, because I want you to give us a Nigerian experience. An accident happens on 3rd Mainland Bridge.
Okay.
Car happens, the tumbles, and the person is stuck in the car. Now, obviously, bystanders come, hey, they're all shouting, hey, that's a Nigerian thing we do. Now, as an expert, what's the first thing we should do at that moment?
Okay, so the first thing you do when you witness an accident like that is to call for help.
Okay.
Because I assume that you may not even be a medical personnel to know what to do. So first thing is to call for help. And in Lagos State, the numbers are 112 and 767. The 112 is a national emergency number, and 767 is the number for Lagos State.
Lagos State.
Once you make that call, at least you know some persons have been informed. That number terminates at the Lagos State Command and Control Center.
Okay.
They will deploy police, they will deploy LASMA if it is necessary, and then they will deploy an ambulance to the scene, or even the fire service if it is necessary.
Okay.
So all of those can converge there, and then they help to move the patient. Now, with regards to the injured victims there, I don't know if you feel the need to do something. It's nice that laymen, first responders, we call them first responders, they are the first people at the scene. They have a bit of knowledge of basic life support. And in recent times, we've been advocating that the general public should learn a bit of this. Now, if they're able to extricate the patient from the scene of the accident, or the ambulance arrives, they can bring the ambulance to our facility. So the ambulance arrives at our facility. From the gate, the security notices that this is an emergency coming in, and they sound an alarm. When the alarm sounds, all medical personnel will march out to receive the patient. The patient is received and taken into one of our 2 emergency rooms, the trauma rooms, where the patient will be triaged and then appropriate treatment will be given. Now, sometimes you wonder, what is he really like? But just imagine the kind of things you see when you watch movies like ER. And those are the kind of scenarios that you also get to see in our facilities. As a matter of fact,
even him explaining, I have goosebumps, because it's like I'm watching a movie, just following your explanation.
But in case that there's no ambulance, sorry,
go ahead.
In case there's no ambulance, because in Nigeria, it's not possible that the ambulance will show up. So it might be in my car. I'll just be, his legs is broken, put him in my car. So as I get to the gate, will the security man allow me to enter?
Oh yes, from the gate. In fact,
That's trauma.
The design is if you approach our gate, you can go straight, and 5 meters you are at the emergency room. If you are not an emergency, we direct you. So from the moment you arrive at the gate, the security man saying that it's an emergency will usher you just 5 meters away, and then an alarm will be sounded. That will summon our team.
Yeah, so it's good that we know that this exists and nobody's praying to have an accident, but there's this sort of reassurance that comes when you know that you're in a country where, or you're in a state where if anything happens, the government has your back, there's a place you can reach out to. So it takes off the pressure of where do we find money first from the family members who are attending to. But I want to ask, what do you think the public can do to sort of support the work you're doing?
So there's a lot to do from the public side. First of all, remember that our services are provided 100% free, paid for by the Lagos State government and willing Nigerians that support us. One of the things that, two main causes of death in our facilities. One is the head injured patient, and then the second one is a patient that has lost too much blood.
Oh.
Blood is 100% free. Sometimes we have patients that require as much as 5 units of blood, and we are required to give everything free. We can donate. As we speak, we have a deficit with regards to blood donation in Lagos State, in Nigeria as a whole. So the public can do a lot. They can be part of supporting us with blood donation. They can actually join hands with us. We have something we call Friends of LASEC, where people with like minds are looking forward to being able to be a part of a team that saves lives. They join our hospital. Sometimes they support us with resources. Sometimes they support us in campaigns, and sometimes they support us with training of our medical personnel. We will look forward to that, and we also know that there is nowhere in the world that health is free. If it is free, someone is paying for it behind the scene, and we must all be part of ensuring that people survive from accidents.
Okay, so I'd like to ask, now that we're here celebrating the anniversary, 15 years anniversary, is there any package that the hospital leadership have for its staff, the community on this anniversary? Because I want to believe that the people working there should also enjoy benefits and be happy that they are working there.
Okay, so part of what we do in the hospital is to ensure, because our staff are charged with the responsibility of taking care of the victims and the public. Our responsibility, my responsibility as a CEO, is to ensure that my staff are motivated and are able to do it under an atmosphere where they feel appreciated and compensated. So part of what we do is to ensure that little things, and you'll be amazed at how far little things of like making refreshments available when you have been working, making sure that we support you with adequate resources, making the environment conducive, are some of the things that we do for them. And then also training them. Okay. You'll be amazed at how, feeling that you are getting the kind of training you deserve and you need to deliver at your job makes it move people to reconsider Japan. Yeah. And that's for...
Okay. Emmanuel, this is a final question.
Okay, so I wanted to listen to answer me. Do you sometimes feel overwhelmed at work? Is there sometimes when you have too many accident cases and your doctors are overworked, is there a need? You can use this opportunity to call for, expansion of the hospital facility or more staff for support.
Well, most times when we find out that, like, when there's like a mass accident or, a collapse or something, and there's a lot of patients, the general staff are able to support the clinical staff in whatever way we can, so that they don't get overwhelmed. So we work like a family. So we don't. Well,
and sometimes we're also able to call in people
space.
that are...
How do you deal with space if it's... that area is known for the Adeolu Bridge and the fires.
Yes.
So how do you cope?
As a matter of fact, this might be a good opportunity to raise this. Just to inform the public that there's a need to be cautious when you approach that bridge. There was a particular week where we had a series of accidents. And some of them were lone accidents. But it seems that by the way of the design of that bridge, the slope, and then the sudden rise, people, if you speed into that bridge, you may lose control. So I want to encourage the general public to be mindful of that and to mindfully and actively take caution as they approach.
We have to let you go now, but there's a question in my head I think is really important. So, you do accident victims, but regular folks in the house, my son just jumped from the from the roof and falls down? Can I bring him over? It has to
Oh,
go
that's
to
an injury. So we do all injuries.
all injuries. So as
Gunshot,
long as an
collapse
injury,
building,
doesn't have to be a road car accident. As long as an
Doesn't have
injury,
to be.
they can come to you.
Any
Okay.
injury can come.
As long as not full of injuries.
Labor on the road.
Yeah.
The one that goes into labor on the road.
labor, okay.
There are special hospitals for that. The MCCs by government are there.
Okay. They have to run off. Thank you so much for wishing you all the
Pleasure.
best.
Thank you.
Thank
Let's
you
go to a
very
short
much.
break now. We'll come back more to our next segment. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.